Back with you here on News at Prime. Thanks for staying on. Hunger persists in South Africa despite government's efforts towards food security and the existence of numerous policies and programs across several ministries. South Africa's constitution commits the state as a duty bearer to ensure that everyone has access to sufficient food and that every child has basic nutrition. But despite this, 11,000 children die from hunger and malnutrition every year. We're joined now by Professor Stephen Devereux, development economist at the Institute of Social Development, University of the Western Cape. Prof, good to have you, and thank you very much for your time. How seriously is South Africa, the government I'm talking here, taking this issue of hunger, child hunger in particular?
Good evening, Thabo, and thank you for this invitation. Well, you know, this week was World Food Day on Thursday, and so we focused attention on this issue. The President also spoke yesterday at the Social Justice Summit organized by Professor Thuli Madonsela in Cape Town at the CTICC on food security and peace, and highly emphasizing the issue of hunger, high food prices, the importance of dealing with food security issues. And so we at the Union Against Hunger, which is a social movement that I'm a part of, we have been campaigning very strongly this year for focusing on child malnutrition and ending deaths by malnutrition and starvation in South Africa. We are well aware of those stories we heard, especially from the Eastern Cape, of children dying from starvation, deaths, as you say, amounting to 11,000 a year. So what is the government doing about this? Well, of course, we have a range of amazing programs. We have the social grants, the child support grant, which reaches 2 out of every 3 children. The National School Nutrition Program, which feeds 10 million children at school every school day. Even the SRD grant, it's quite small, but it's 370 Rand. So we have social grants, we have school feeding program, we have EPWP, the Public Works Program. We have a new food security and nutrition policy, which has just been revised and will be signed off by the government very soon. So the paradox is, since we have all these policies and programs and support for poor people, and we grow enough food in South Africa, we have more than enough food to feed everybody, why then is there still this paradox of high levels of child malnutrition and high levels of child mortality, even from lack of food? Yeah. And just to give you one more statistic before we move on, the level of child stunting, which is an indicator of chronic inability to access enough food, has been rising since 1994, when it stood at 23%. It now stands at about 29%, which means that close to 1 in 3 children is too short for their age. Yeah. And we wonder why this is, when we have all these amazing programs and policies, as I've said. So
does that mean exactly the government social programs are failing? I mean, the president would have highlighted those again at that justice gathering, program that he was talking, increase social grants, expand school feeding programs, support ECDs. Does that mean those programs are not working? Or is there a failure at the level of our health and community-based initiatives? I mean, are we at a level where our health services are able to prevent and treat malnutrition and strengthen our clinical capacity for growth monitoring?
I think you touched on a very important point there, Thabo, which is that we cannot solve the problem of hunger and malnutrition in this country with just cash transfers. Obviously, people who are very poor, who are unemployed, there's nobody working in the family. Of course, you need to give them some kind of cash and access to food through buying food. But the problem is that the cash transfers are not big enough. They're not even reaching the level of the food poverty line, so that you can't buy enough food. And secondly, it isn't just about cash and buying food, because the child also has to be healthy. The child also has to be treated at clinics for malnutrition. The mother also needs to be well nourished. And so what we need, and if you think about school feeding, that only starts at 5 or 6 years of age when the child reaches primary school. By that time, the child's already been 5 years undernourished. And so, you know, when we measure child stunting, it's for children under 5 before they even reach school. So we need to have more support to ECD centers. And we noted that this year in the budget, there was the increase in nutrition support to the ECD centers, but of course, only the formal registered ones, not the unregistered ones, where the poor people send their children. So we need to have more support for ECD centers. We need to have more support for healthcare, as you mentioned, especially around pregnant and lactating mothers. and infants. The first 1,000 days is really crucial. And so we also recommend, for example, a maternity support grant, so that the child support grant extends backwards into pregnancy, which means that the mother can get enough nutrition while she's pregnant so that she doesn't give birth to an underweight baby. Because that's one of the problems. If the child is born underweight, it's likely to remain underweight and not catch up. Yeah, so there's a lot of things that can be done to try to see the problem of hunger in a more intersectoral way, a more multi-sectoral way, where health and social development and agriculture and other sectors are working together to try to improve the overall context of dealing with hunger in this country.
What does that mean? Does that mean we need policy changes? Is there a broader systemic approach that we need as far as getting those spheres of government to coordinate?
Absolutely. And so one of the things that we have been campaigning for is for the establishment of a national food commission. It could be a commission, it could even be a ministry of food, probably a national food commission with local food councils, which focus exclusively on this challenge of reducing child malnutrition and ending hunger in South Africa, because all the indicators are going in the wrong direction right now. So what we have been looking at is the success story of Brazil, which is often mentioned, where a serious focus called the Zero Hunger Program in the early 2000s, in President Lula's first term, managed to get their stunting rate down to 7%. And our child stunting rate has been going up and is now 29%. And in so many ways, Brazil and South Africa are similar. We should learn from Brazil. A coordinated, focused effort on the objective of ending hunger was introduced to Brazil, which we didn't have here. There's an assumption that giving people social grants and school feeding and all of that will be enough to do the job, but it isn't really seeing the problem holistically and bringing all the different actors together that can really take this problem seriously and find a strategic solution to it, which involves many spheres of government.
Prof, I know we've been focusing on government, but is the private sector coming to the table? Are they literally playing their part?
Well, you know, the state is obviously the immediate duty bearer for the right to food. And so the citizens have a claim on the state for access to food. That's in the Constitution. And for children to have basic nutrition. That's also in the Constitution. But the corporates, specifically the food retailers and other actors in the food supply chain, they also have responsibilities not to impede rights from being realized. So, for example, if the supermarkets are charging unreasonably high prices for basic food items, that can also be seen as an infringement of the right to food. So we feel very strongly that the fact that the big five supermarket chains earned 20 billion rand of profits last year, 20 billion rands, let me repeat that, mostly by selling food and often to poor people. For example, ShopRite mostly operates in lower income areas. They earned 14 billion rand profits last year. This cannot be acceptable because we know that they are actually profiting from hunger. So they need to be regulated. They should either bring their prices down voluntarily or they should be compelled to do so by the state. So the state can intervene by protecting health and by providing people with cash to buy food, but they can also intervene to stop the corporates from charging unaffordable high prices. One of the main problems that people face is the high prices of food in the shops. And so if we can bring those prices down and stop the companies from profiteering. For example, recently the Competition Commission has put out a report saying that the prices of eggs and maize have been going up in the supermarkets, while the price of eggs has actually been falling, the producer price has been falling, and the producer price of maize has not been rising. Wow. So it clearly means that the supermarkets are making unfair profits off their retail prices, whereas the producer prices have not gone up and in some cases are going down. Why doesn't that transfer to the consumers?
Indeed. Prof, appreciate your time. Let's leave it there for tonight. Professor Stephen Devereux, development economist at the Institute for Social Development at the University of the Western Cape.